Okay, so we are going to do range of motion. We're doing his neck, shoulder, and leg. So the first thing that you would want to do, of course, is check the provider's orders to make sure that you're going to do whatever you're going to do correctly. Then you would walk into the room, you would introduce yourself. So I'll be your nurse Ari today. I'm here to do a range of motion exercise. And then you would go ahead and check 2 patient identifiers. So you would ask the patient his name and date of birth.
Travis, 12/11/88.
And you would also check his wristband to make sure that it matches up. Next, after that, you would go ahead and perform hand hygiene, and you would put some gloves on. Alright, so we're going to start with the neck first. So we're going to go ahead and do flexion, so it's bringing the head down, and then extension, which is bringing the head back to an erect posture, and then you also want to do hyperextension, which is bringing the head back as far as possible, but you're not going to pass resistance, and if the patient has any pain, you're going to stop. You'll bring back the head to the erect posture, and then you'll do lateral flexion as well, so it's bringing the head to both shoulders, just so. Okay, so next you would want to do the shoulder. So again, we're going to do flexion, which is bringing the arm up, and then extension, which is bringing the arm back down to its regular posture. And then you would do hyperextension, so you'd ask the patient to lean forward a little bit. You'd keep his elbow straight, and you're going to push it back as far as it can go, and that's hyperextension. And then you would want to do abduction, which is bringing the arm out with the palm facing outward, and then adduction, which is bringing the arm back in. You will do internal rotation, which is flexing the arm up, and then external rotation, flexing the arm back down. And then you want to do the circumduction, which is bringing the arm in a complete full circle. So you're just going to move it completely around, making sure that there's no pain, and that passes for that. Then you're going to have the patient go ahead and lay down. If they need help, you'll go ahead and help them. My patient is able to move. Okay, so you're going to check the range of motion of his leg. So you're going to do flexion, which is bringing the leg up, and extension, which is bringing the leg back down to its normal posture. You're going to do hyperextension, which you would have the patient go ahead and roll onto their side. And hyperextension is bringing the leg back to its farthest point. And then from this point, you could do abduction, which is bringing the leg up, abduction, which is bringing the leg over the other one, so crossing his leg. And then here you can do internal and external rotation. So internal would be taking the foot and the leg and moving it inward, and then external rotation is taking the foot and the leg and moving it outward. And then the last one that you would want to do is the circumduction. So again, just like the shoulder, you're going to move the whole leg and hip around in a full circle. So go ahead and move it around in a circle. Perfect. So the patient obviously passed all of that, and those are my 3 range of motions.